like to call the House Health Subcommittee to order. Will the clerk please take the roll?
Representatives Hicks. Here. Jernigan. Leatherwood. Here. Martin. Here. Mitchell. Sherrill. Here. Terry.
Here.
Williams.
Here.
Hawk is in another committee, and Chairman, you have a quorum.
All right. Thank you. As she pointed out, our chairman is presenting a bill in another committee. He's supposed to be number one on that calendar, so they trusted me with the gavel for the time being until he gets back. So do any of the members have any personal orders? Representative Martin, you got to, you're recognized.
Thank you, Chairman. It is my honor to recognize my favorite people today. The chiropractors are here for Tennessee Chiropractic Day on the Hill, so welcome them in.
All right, thank you. Okay, any further personal orders by the members? Okay, seeing none, we have a pretty robust schedule and our calendar, so we will go right into it. House Bill 981. Chairman Faison, and let me clarify this. Had we put on an amendment? We've already put the amendment on this. Is that correct?
Yes.
Okay, so it is amended, and you are recognized.
Thank you, Mr. Chair. I'm excited because my back needs a little tweaking with all these chiropractors. Surely somebody in here can give me an adjustment. Okay, so that fell flat.
Yeah, on the bill.
All
yeah.
right, so I'm going to move on to our bill. Thank you, Mr. Chair. Committee, I briefly got to speak about this last week just to bring you back up to speed. In Tennessee, we have over 100 boards and commissions that govern, promulgate rules, carry out the will of the legislature. There are occasions that the legislature gets at odds with boards or commissions. There are things that the legislature's done. The EMS board has been a little bit of a sticky issue several years. So interested parties have worked from one end of the state to the other and got just about everybody in agreement, which is an incredibly difficult thing. From the Ambulance Service Association to the Fire Chiefs Association, the Professional Fire Chiefs Association, the Hospital Association, the TMA, Tennessee County Service Association, the Nurse Association, the Association of Rescue Squads, the EMS Educators Association, Tennessee chapter of American College of Emergency Physicians. You get that many people agreeing that the board, as presented in this bill, is a good thing. I feel like we're doing something, and that's what this bill does, just reconstitutes the board, and we have these people in agreement with it.
Chairman Williams, you're recognized.
Thank you, Chairman Hawk. Welcome back.
It's good to be here. Thank you.
The Chairman Faison, thanks for last week being understanding. This is kind of an issue for me personally because I have friends that served on this board for many, many years. Could you tell me how we got to the position that we currently are and that we're having to reconstitute a board?
Chairman Faison.
Mr. Chair, we do have the Fire Chiefs Association, some other people here who are willing to testify on this and kind of give some more of the history, and I believe they're on the list.
We have the notification from last week, which we'll carry forward to this week, so we'll be happy to go into recess without objection. Ladies and gentlemen, who would like to speak on the legislation? And please forgive me, we did not have my notes with your names from last week. If you could please introduce yourself and begin your testimony. We have 3 minutes whenever you begin, and you are recognized.
Thank you. I'm John Selberg. I'm the fire chief in Collierville. I'm here representing the Tennessee Fire Chiefs Association.
And I'm Todd Heffer, and I am the president of the Tennessee chapter of the National Association of EMS Physicians.
Okay. Chairman Williams.
Thank you, gentlemen, for coming. Thank you for your service too. Just a quick question: Tell me the circumstances by which the EMS board was sent into sunset and the reasons why a new board needed to be reconstituted. I'm clearly not connected enough to know why the reasoning was. It's very unusual. Could you share with me a little bit of the history as to why this was done last year, which is why we find ourselves where we are this year?
I can't speak for Senator Bell that this originated with. I know there was some concern over the handling of a matter at the time, and he became dissatisfied with how the board was addressing that matter. So the concern was initially to actually get rid of the board. Obviously, that can't be done because we'd all lose our paramedic and EMT licenses. So at that point, we tried to work together to, I think, improve the board and get better representation so that maybe we can address more of the issues that we have across the state, and including that issue that he had.
Yep. Thank you, Chairman. Thank you. I get that. I guess the reason why I'm asking the question is I went back and watched the video from last year where Senator Bell had some issues. I couldn't really find an issue that I could wrap my arms around. Oh, okay, this is what happened, and this is why we're took them into sunset. When you go back and watch the film, it looks as the live stream. It looks as though there was not given an effort for the board to be able to respond to his concerns, and they simply adjourned the meeting after a vote without much discussion. Or were you aware of that? Were you there that day?
Yes, sir. I was there. I can't obviously speak for other agencies, but
Right.
I know there was concern over the licensing for transport of what we call EDP patients, and that there was a concern about trying to do a license outside of a single county, and that was initially where that started.
So, Chairman Hawk, I know you're covered up paperwork. Is it okay if I just? Okay. Sorry. The reason for my question or concern is there was some challenges as related to how licensure should occur across county lines, particularly when it came to private businesses and the fees in which they pay, or the counties in which the fees in which they pay. So there was lots of confusion as to whether you pay one time for a license and it applies to the entire state or the other. And I think that's what the issue was. Were you concerned at all that there was an issue as it relates to public safety, since there had been some incidents with these practitioners who were transporting mental health patients?
So that issue was not affecting our area. We already had that addressed in our area. So that was not really of concern of the fire chiefs. Our concern was more at the level of the makeup of the board at that time. So the opportunity to revisit the makeup of the board. Dr. Heffernan is probably more engaged in that.
So yeah, so what happened? And initially there was a lot of panic, obviously with Senator Bell's statements and kind of the potential steps and the fallout down the line that could happen because of that. With that, kind of each of our stakeholder organizations kind of came together over a couple-month period. There were a couple of preliminary drafts of the board constituents kind of at the end of last year's session, and essentially it got tabled in the Senate, and Senator Bell and Senator Reeves were tasked with taking that over the summer and bringing us all together. So beginning, I think it was back in May, a notice was put out for the various stakeholder organizations, and starting in May, we had about a meeting every 1 to 2 months with the various stakeholder organizations to kind of work through a variety of things, you know, one of those being the EMS board and a couple other topics. And then over the summer and into the fall, we kind of worked together both outside of those meetings as well as with Senator Reeves, and ultimately culminated then in kind of a joint coalition meeting in December where we all sat down in a with the Vanderbilt EMS Center for Excellence kind of mediating that to kind of come to a consensus of what that EMS board should be. And I think the concern is a lot of this got triggered by what may be viewed as a very, you know, minimal, issue, But the EMS board was created in 1972 and has remained unchanged over the past 50 years. And I think what the majority of us see is that the makeup of that board is the same as it was in 1972, yet the stakeholders are much more diverse. And so we're looking for something that's a little more inclusive of what EMS is in 2023, not 1972.
Thank you. And very, very good synopsis. I guess I have two more questions. One for you, sir, as it relates to the involvement of other people in this collaborative effort through Vanderbilt. Appreciate that being the case. I guess the question would be, was there an undue or was there any pressure to come up with a solution because the EMS board was set into sunset last year, or was that the impetus for the meeting, or was the board not technically set into sunset last year? Because I assumed that it was.
No, it was sent into sunset, sir, and then
So-
we were tasked by, Senator Reeves was tasked to kind of bring us all together and to kind of redevelop it.
So Senator Bell and Senator Reeves, in their actions last year, in conjunction with the House, created a deadline of which action had to be done this year, and that's what your committee was tasked with doing. And you got all the stakeholders that you could in the room together to discuss that, and this is the byproduct of that work.
Yes, sir.
Okay. I just have one question for you, Chief. I've got correspondence from Memphis Fire Chief, Deputy Chief there today. Are you concerned at all that large metropolitan or urban areas are not represented in the new makeup of the board? Based upon what I heard from the Deputy Chief there, they do have some concerns since they weren't at the table during this discussion.
So I don't believe so. I'm actually friends with him.
Well, it's actually Miss Sullivan, it looks like.
Chief Sullivan?
Yes.
Yes.
Okay.
Yeah, the EMS chief.
Yes.
Yes, sir. They have been involved in that. I know there was a concern that they had for another bill that was being discussed.
Okay.
This bill, actually, I think they've been supportive of.
Okay.
What I've understood, that this will actually place a representative on there from the Fire Chiefs Association, also from the professional firefighters. So you have the line personnel and the administrative personnel that honestly are running most of the EMS in this state right now. They're one of their EMS division chiefs has been heavily involved in this because they're involved in the mobile integrated health, and that's been one of the issues that hasn't been addressed yet at our state, and that we've wished to have that addressed because that seems to be the trend, particularly with those larger urban areas. And so we're trying to, I think, look in the future with this board.
Okay. Thank you, Chairman. Thank you, gentlemen, for your testimony today.
Thank you, Chairman Williams. Thank you, gentlemen. Any other questions while we're out of session for the witnesses? Seeing none, thank you, gentlemen, very much. Thank you. We are back in session. Chairman Faison.
Thank you, Mr. Chair. I wanted to bring up one point of clarity from Chairman Williams. He said, referencing that the former Senator Bell and Senator Reeves put together and kind of put a deadline on this. It wasn't them that put a deadline on. When you put an agency or commission in something called wind down, you have until June of the following year, which would be June 31st, that organization will cease to exist if you don't reconstitute it. So just because our current law, that's why there was something put together to make sure that there's a working group who can come with a general consensus from across the state before we get to the point that you do become sunsetted as an agency. So I just want to bring that up.
Chairman Williams, you're recognized.
Thank you, Chairman. I know you served in GovOps Chairman for many years, so you're much more well-versed in this than I. And thankfully, I begged the Speaker to get me off GovOps many times. But,
So did I.
But I will say, just as a point of clarification for my own, when they voted on to put it in wind down, as you say, if this body, the House and Senate, together, if they don't act on this bill, these people lose their license this year or next year?
Chairman Faison.
Thank you, Mr. Chair. The EMS board will cease to exist July 1 if we don't act on this.
Chairman Williams.
So to my point, that's the point I was making earlier. Had they not acted to send them into wind down, then this deadline of June 30 wouldn't exist. And so therefore, something had to be done now.
Correct.
And that was a little bit of my concern, because had we not put it in a wind down, then we could have taken our time, made sure that we'd done everything that we could possibly do, because I think we were all in agreement that there needed to be change. I'm just not certain that putting it in such a expeditious wind down is the best solution. But based upon the discussion of the chief and the doctor here today, I'm confident that they believe this is the best direction. So happy to
Chairman
happy to
Faison.
help.
Thank you for that. And I will tell you, the committee, this, it's not uncommon for the Government Operations Committee to put a board in wind down. As I chaired, as the chairman just pointed out, I chaired it for 4 years. There were several boards under the Haslam administration that we just completely vacated because it just needed some help. And we would do that in the summer, and then by the time we got back in January, we had a whole new board constituted with law ready to go to reconstitute. So it's not uncommon what we're doing. And I would agree with the chairman that it went pretty quick, but it's just not uncommon as well.
Representative Mitchell.
Thank you, Mr. Chair. But getting back, so we don't feel like we're being forced on a time factor. You, as chairman of government operations, know we can bring a bill to extend that time frame of that organization at any time during this session. And on top of that, we can also amend the omnibus rules bill as well, can't we? So, I mean, we've got time. You know, if somebody's uncomfortable with, where we're at, it's not like this is going to go away. There's options to be able to fix this. Correct?
Chairman Faison.
Well, we have a bill filing deadline. You'd have to find a caption bill that do it, and then you're also taking it would originate back in the same committee that did this in the first place. So I would say it would be somewhat of a redundant thing to try to undo what the committee had done last year. But I mean, theoretically, yeah, you could sell the dome off the Capitol if you can find the right caption and enough votes.
Representative Mitchell.
Yeah, but the bottom line of it, you and I both know the omnibus rules bill opens up every title in the state code that goes through government operations. You can do just about anything you want to as chairman of government operations with that piece of legislation, as well as if it's an organization like this, you can bring up an administrative bill at any time during the session. Bill filing deadline has nothing to do with that.
Representative Faison.
If we could do everything, I'd say we'd put something to roll on this bill to let the representative from Western Davidson County be excused, but I don't know if we can go that far.
Now that we know where we're from. I don't think he knows where you are. So it's good you're 10 feet away. So. Any further questions or comments for the sponsor? Are you ready to vote? All those in favor of sending House Bill 981 to Full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Put Ryan Williams down as a no. Ryan wanted to be recorded as a no. All right, ladies and gentlemen, we are moving on to item number 2 on our calendar, House Bill 859. Chairman Jernigan, you are recognized.
Thank you, Chairman.
We have a motion. We have a second. You're recognized, sir.
I'm from Eastern Davidson County, if that even makes a difference. It's on the other side. Members, I'm excited about this bill. But,
You have an amendment on the legislation,
I do
Chairman
have an
Jernigan?
amendment, yes.
Let's go ahead and work on that. Drafting code
4763.
4763. Yes,
That's it.
forgive me. You have a motion and a second. Let's go ahead and put the amendment on the bill as we work through. All those in favor of placing amendment drafting code 4763 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended. Please continue, sir.
Okay, now I'm excited. Okay, so anyway, I've been working, the Department of Health and I have been trying to find a path for this since last October. But what this does, it allows the Department of Health to share de-identified data from EMS run reports for the purposes of overdose and response. The sharing of information will help us combat overdoses in real time, getting the resources to first responders in hot spots in communities and counties around the state. I can go into greater detail, but that's a synopsis of it. I'm happy to answer any questions, Chairman.
Thank you. Any questions for the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 859 as amended to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you. Chairman Terry, you are recognized on item number 3 on our calendar, House Bill 514.
Motion.
We have a motion. We have a second.
Thank you, and I do have an amendment, drafting code 4642.
We have a motion and a second on Amendment Drafting Code 4642, which will be the legislation we will work from. All those in favor of adding Amendment Code 4642 to the bill, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. We are on your bill as amended now, sir.
All right, thank you. And as the members know, a few years ago we passed a cannabis commission, and this year there's 9 members on that commission, and the governor's appointments are set to expire. And so what this bill simply does is do what the intent originally was to ensure that we had at least a patient representative on there. And so this would allow that we have one patient that has qualifying condition serve on the Cannabis Commission.
Okay. You've heard the explanation. Any questions or comments for the sponsor? Ready to vote? All those in favor of sending House Bill 514 to full Health Committee as amended, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill moves forward. Chairman Terry, you had requested to move forward on item number 11 on our calendars. Are you prepared
Yes.
to? Okay.
Yes.
Chairman Terry has a second bill on the calendar. Item number 11, House Bill 325. You have a motion, you have a second. You are recognized. And Chairman Terry, we've got several amendments that we're looking at. If you could identify which amendments you'd like to move forward with, or amendments that you'd like to move forward with, please, sir.
We are move forward with 5650.
Okay. Ladies and gentlemen, you will notice that that is an amendment presented by Chairman Terry.
Motion second.
We have a motion and a second. And he will be able to explain. It looks like that will help clarify the bill. We're going to go ahead and put Amendment Drafting Code 5650 on the legislation. Please, all those in favor, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill is amended with that amendment, and you are recognized, sir.
Thank you, Chairman and Committee, and for those in the audience and at home. A few years ago, we put forth the Tennessee Together legislation. That was Governor Haslam initiative. I think you were in leadership for us at that time and helped carry that. And our subcommittee and the committee at that point in time and the speaker spent a lot of time and effort on getting that bill right. And this past year, essentially, the CDC came back with their guidelines agreeing with what we did years ago. And so that bill actually had a sunset that sunsets this year, but it has been effective for us. We've cut down the number of opioid prescriptions. We've cut down on the length of the prescriptions. And so what this essentially does is removes that sunset that will keep it in place. And then we have a few other tweaks that help with patients. And then the last thing that I added on there, it was our hope that this legislation, T and Together, would not go into perpetuity, that we would get the problem solved. Obviously, the problem is still ongoing. But what I want to ensure is that that the Speaker, the Governor, and the Chairman of Health in the Senate and here get a letter from the department saying that every other year, saying how effective it is working for us. So I don't want it to go on the back burner. So if we have to make changes, we can do that. And so with that, I'd ask for your support.
Thank you very much. Any questions or comments? And I do recall the conversations that we had 5+ years ago, and the tremendous role that you played in your leadership on the Health Committee, Health Subcommittee at the time, and to help us get that right. We're certainly not in a perfect spot, but we're hopefully heading in a better trajectory than we were. It's still one of the most challenging issues that we have to face as a state, and I appreciate the continued work on this. Any further questions or comments? We're ready to vote. All those in favor of sending House Bill 325 to full Health Committee as amended, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you very much. Ladies and gentlemen, we are going to move a bit out of order here. Chairlady Hazelwood has come into the room, and considering Chairlady Hazelwood has the purse strings, we are going to go to item number 7 on our calendars. If you could please follow with me to item number 7 on our calendars, House Bill 275 by Chairlady Hazelwood. You are recognized. You have a motion. We have a second. We have a second.
Thank you, members. This is a very simple bill. Back in 2017, I carried legislation in the House, and then Senator Dickerson carried the companion legislation in the Senate that enacted an opportunity for a syringe service exchange program, which has saved a lot of lives in Tennessee. It's got a lot of people into treatment, and it has also prevented outbreaks. We have evidence of HIV and Hep C outbreaks that were prevented because of these programs. One of the caveats in the original legislation limited the, as we do with many other things, under the current law, the needle and hypodermic syringe exchange programs can operate in metropolitan areas, Nashville, Knoxville, Chattanooga, and Memphis, within 1,000 feet of a school or a park. The rest of the state requires a 2,000-foot minimum operation. This has created some issues in some of our rural counties. They're not, or rural areas, they're not able to find a location suitable to provide the program. And unfortunately, our rural counties are just as, if not more, impacted by this issue than our metro counties. In fact, 30% of the new enrollees are from our rural counties. So this bill would just make it 1,000 feet statewide from school or park to provide these programs. And I just want to, again, say to you that this program has changed lives. It has saved lives. We have put people into treatment, and we take in more needles than we give out. So that means that there are people who are, it's a gradual process, as those who have battled addiction or have friends and family who have, it's an ongoing issue. But again, by having this program, it brings people into the system. They're then required to get counseling, to hear about treatment options. And with that, I just hope that we can continue to provide the same level of services in our rural counties, to provide these opportunities, and to continue to contain and hopefully at some point prevent both the need for needle exchange and the HIV and the Hep C that too often comes with it. So with that, I would ask that you all would support this piece of legislation.
Thank you, Chair Lady Hazelwood. Representative Mitchell, you're recognized.
Hey, thank you, Mr. Chair. Is there any federal funding in this?
The funding is these these organizations are all not-for-profits that provide this service. There is some federal funding, and then they do a lot of fundraising in their own communities to support the program.
Thank you. Chair Lady, I will mention to you, my district is not quite as gung-ho as you are about this particular piece of legislation. So I understand where we have been on this particular piece of legislation and your desire to move forward. My district, not quite so much. So just for the record there. Any further questions or comments? Are you ready to vote? All those in favor of sending House Bill 275 forward to full Health Committee, please signify by saying aye. Aye. Any noes, please say no. Please mark me as a no. All right, the ayes have it. Your bill moves forward. Congratulations.
Thank you, and thank you for taking me out of order.
Thank you, Chair Lady.
Thank you to Representative Gant for being such a gentleman.
Thank you. We are now on item number 4, back on our calendar. Leader Representative Gant, the chivalrous, is that a word, chivalrous? Leader Gant, you are recognized on House Bill 584. I think we have a motion. We have a second. I believe that you've been working on some amendatory language from our last week's discussion and right before you took a trip west. And are you prepared to present an amendment, Representative Gant?
Yeah, if we can just put it on the bill, I can talk about the entire bill at that point.
Is that drafting code 5191?
That is correct.
Okay. Ladies and gentlemen, we have a motion. We have a second on Representative Gant's amendment. Let's go ahead and put that on the bill. All those in favor of placing drafting code amendment 5191 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. We are working on your bill as amended now. You're recognized.
All right, thank you, Mr. Chairman and committee. This continues a conversation that we had last week. Chairman Williams had raised some concerns about the contiguousness of the southern Tennessee border with other states, and so we have reached out to legal to draft legislation that addresses that problem, and what it does is the amendment limits the conditions of the bill so that it only applies to Magnolia in Corinth, Mississippi, and the emergency room in question in Selmer, Tennessee.
All right, you've heard Representative Gant's description of the bill as amended. Questions or comments?
A quick question.
Chairman Jardigan, you're recognized.
What's your population now? Are you worried about ever going over 27,000 or?
Well,
You're recognized.
as I was saying, legal drafted this legislation, so it meets the questions that were raised in the last committee session that we had here last week. So that's what we're going with.
You're recognized, Chairman Jardigan.
Yeah, I mean, I understand it's written for that. I just thought that if your population ever goes over 27,000, I guess you'll have to come back and.
We'll make a
Hopefully
return visit, but I doubt it will be me as the representative, so.
That's all right, fair enough. Fair enough. All right, thank you. Cut that out.
Mr. Chairman, if you'd like, I can go into further detail if it's with the indulgence of the committee, if they'd like to hear more.
Thank you. I was just conferring with legal staff about the parameters of that and the 27,000 population within a certain date specific of a census taken. So there are some parameters to that. Okay. Do we need any further communication from the sponsor of the legislation? Dr. Terry, Chairman Terry, you're recognized.
Yeah, I just, if this goes on to full committee, I just, for the record, I mean, just, I still have concerns about essentially creating one area for somebody that's outside of this state. And I understand the need in there, and I don't know the fix, but maybe between now and if this passes or whatever it does, maybe I can come up with some other fix, but I just have that concern that we're creating this one exemption for somebody that's outside of the state.
Yeah, if I could, Mr. Chairman.
Representative Gant.
I totally agree, and the original intent of the legislation addressed that very issue. So, but now that we have the amendment to address another concern, you know, it's kind of, you know, we're flip-flopping back and forth, addressing your issue first and then addressing another issue now with the amendment. So, and legal felt confident that this, you know, stood constitutionality as far as how we have it written. So,
Chairman Terry.
Yeah, my issue is not about it applying statewide. I just don't want it to apply state. Period. if that makes sense. But I don't know how to fix that for you, and that's something that maybe we can have those discussions.
yeah. And in this situation, if I could, Mr. Chairman, the hospital in question here that would respond to Tennessee is like 14 miles from the center of McNairy County, which is totally underserved when it comes to these emergency care situations. And so it's kind of a little bit unique in one way, but it's but the biggest thing this legislation does is it helps us potentially address a huge gap in emergency care for my constituents there in McNairy County. So, and I do understand where you're coming from.
Thank you. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. How far are y'all away from Memphis?
Where's my Google map when I need it? I guess probably 70 miles.
I was going to say 80. How far are you away from Jackson?
Jackson, I think, is almost 30 miles.
On a 2-lane highway.
Well, no, it's 4-lane.
4-lane.
Yeah.
So, but I mean, somebody having a heart attack, something. I mean, he's in an area where we know how to fix this, but no one wants me to say those 2 words. We know how to fix it, but it's called his small town hospital is closed down. We know why it's closed down, and now his folks don't have emergency care. So he's trying to do the best he can without me saying those 2 words. Thank you.
Mr. Chairman, this sounds like bipartisan legislation.
Thank you. Chairman Leatherwood, you're recognized.
I want to thank the sponsor for bringing this bill. And Representative Mitchell, you made good points. My wife and her family are actually from McNairy County, as you know. And when the people there need treatment, they have to go to Corinth, which is just minutes away, just a few miles away. And actually, Corinth is the hospital where my father-in-law passed away, actually. Once the hospital closed down there in McNairy County, there are no reasonable options. There are no options close to being reasonable for the people in this area. So my family has experienced this situation personally, and I appreciate the legislation and you're attempting to address this issue. And frankly, I know there'd be a lot of I's to dot and T's to cross, but I don't know that it would necessarily be a bad thing if it did apply statewide, if again you could make sure you had the quality control on it, because McNairy County isn't just one area that's affected by this. There are many, so thank you.
Thank you.
Thank you.
Further questions or comments? Are you ready to vote? Seeing we're ready to vote, all those in favor of sending House Bill 584 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. If you'd like to vote no, please let Ms. Adams know. Your bill moves forward. The ayes have it.
Thank you, Chairman and committee.
Thank you. Item number 5 was House Bill 628 by Chairman Leatherwood. I think the request has been to take that off notice. So item number 5, House Bill 628, without objection, will be off notice. We are now on item number 6 by Chairman Hicks, House Bill 667. Sir, you are recognized on House Bill 667. Motion. We have a motion. We have a second.
Thank you, Chairman. I have some amendments to put on the bill.
Okay, we've got a couple of amendments, and just looking at the posture in the Senate, sometimes we will roll amendments together, but it looks like we've got the Senate bill has presented 2 separate amendments, and I think we, as a committee, want to go forward with 2 separate amendments.
Okay.
Is that?
Mm-hmm.
I believe that's where we are.
Yes.
All right. We're going to go first with Amendment Drafting Code 4805, and we can have that explained to us later. Let's go ahead and get the amendments on the bill. All those in favor of placing Amendment Code 4805 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended first by that amendment number 1. And amendment number 2 is another criteria for the piece of legislation. I believe it's drafted code 5053.
Correct.
That's accurate. All right. All those in favor of placing amendment drafting code 5053 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. You are now on a fully amended piece of legislation. Chairman Hicks, you're recognized.
Thank you, Mr. Chairman. House Bill 667 amends Tennessee Prescription Drug Donation Repository Program, and it will be known as the Kevin Clausen Drug Donation Act. Prescription drug donation repository programs can accept and dispense donated prescriptions and supplies when requirements are met and are regulated by the State Board of Pharmacy. A prescription drug donation repository program is responsible for developing and implementing standards and procedures to determine that donated prescription drugs appear to be unaltered, safe, and suitable for dispensing. Every year, billions of dollars worth of medications end up in landfills. These programs This program allows unopened and unexpired medications to be redistributed to qualifying individuals and prevent medication waste and increase medication access to individuals in need. That's the biggest part of this, is individuals in need. In an effort to align with national standards for such programs, Tennessee's program has the opportunity to modernize to meet the demands and needs in the state. Certain areas of focus will include broaden the definition of donors, redefine the income qualifiers, more specifically the definition of indigent, redefine eligible recipients, and expand the list of acceptable medications. This bill is something that has been, I guess, in Tennessee for this act has been for some time, but it's just time for it to modernize and really start specifying and putting this to work for the people that needs it the most. And I think that that this bill will accomplish that.
Thank you very much. Questions or comments for the sponsor? Seeing none, are you ready to vote? All right, all those in favor of sending House Bill 667 forward to full committee as amended, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman. Thank you, committee.
Thank you very much. We have already disposed of item number 7 by Chairlady Hazelwood. Item number 8 on our calendar, House Bill 469. The request has been to roll this bill for 1 week. Without objection, bill is rolled. House Bill 469 rolled 1 week. We are now going forward with item number 9 on our calendars, House Bill 1311 by Chairman Dr. Kumar. Chairman Dr. Kumar, you are recognized with a motion and a second. You're ready to go, sir.
Thank you, Mr. Chairman and committee. House Bill 1311 addresses a situation where a person has graduated from medical school. They have passed step 1 and step 2 of their licensing exam, and then they apply for a residency, which is a computer match. And things happen and confusions happen, and for some reason they did not match. So at that time, they don't have an option to go and practice because they need at least 1 year of postgraduate training before that can take step 3. And a lot of these people end up working in research labs, but most of the time they are in limbo. Other states, such as Missouri and I believe in Kentucky, have a program that these young people who have, again, graduated from med school, passed step 1 and step 2, have not matched in residency, they will be allowed to work under the supervision of a collaborating physician in a needy area for a year, maximum of 2 years. During that time, they should be able to match in residency and go on with their career. It will help us retain these graduated physicians or doctors within Tennessee rather than them going out of state. Last year, about 640 doctors graduated from med school, and about 10% of them do have this problem. So we're dealing with as many as 60+ physicians, and if we can do something to retain them within our state, that will be good. And again, they'll be fully supervised, and they will work in underserved areas. Thank you.
Thank you. believe you've explained the bill, and we do have an amendment, drafting code 5370, that
Yes,
helps to
sir.
accomplish what you've explained.
That is correct, yes.
Yes. We have a motion and a second. Amendment drafting code 5370. Any questions on the amendment? All those in favor of placing amendment 5370 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. All right, thank you, Chairman Dr. Kumar. I think you've explained the bill as amended. Any questions? Dr. Terry, Chairman Dr. Terry, you're recognized.
Thank you, and appreciate you bringing the legislation. Just trying to think of logistically. So there are the students that this may be match week. They may be matching today or tomorrow. I think it's match week. It is today. There we go. Appropriate. So if they do not match, usually the next day is called the scramble, where they try to find a spot. So do these just simply not want to scramble, or how do they end up?
For some reason, they did not get the specialty they would want during the scramble. Scramble is usually family medicine and so on, and these people may be interested in a specialty. There can be many reasons.
Okay. I guess if they don't get the specialty that they want, or whatever that they want, and they don't scramble into an intern year or something like that, is this like an alternative to an intern year, where they'll do like up to 2 years, but are they going to try to match? Is that your goal? Is for these people to try to match elsewhere while they're continuing to help us here in Tennessee?
Thank you. Yes, that's exactly the goal. That's why it's limited to 2 years. It's not presenting them a career option,
All right.
certainly.
Thank you.
All right. Any further questions or comments for the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 1311 for the full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward, Dr. Kumar.
Thank you.
Thank
you.
you.
Members.
Chairman Dr. Kumar, we are looking at item number 27. You have item number 27 on the calendar, and I'm going to look to my right and my left to see. We have somewhat strategically placed the calendar in the order in which we could in order to get some less contentious bills moving forward, and I'm going to look to committee members if they would be willing to go to item number 27 on the calendar. House bill is, well, before we call up a bill, I'll ask you to take a quick look at it there, members. All right. Looks like without objection, we will move forward in our calendar to item number 27, another bill by Chairman Dr. Kumar. House Bill is 1312. You have a motion and a second, sir. You are recognized.
Thank you, Mr. Chairman. Thank you for the indulgence, and I appreciate it. This continues, I guess, in a way, an effort to bring more physicians into Tennessee. We are short more than 1,000 physicians, and really 92 of our counties are considered to have physician shortage. This is a situation where an international medical graduate who has practiced for 3 out of the last 5 years in their home location moves to United States. Normally, they would go through another residency, but this gives them a pathway that if they have practiced 3 of the last 5 years in their home state or country, and they have proper qualifications and an institution, which is a teaching institution, university or hospital in the United States, is willing to give them an offer to come work for them. In that case, we would give them a temporary license that they can work after their qualifications have been verified. And after 2 years of satisfactory work, fully under supervision, fully in an institution that has an approved residency program, then they would get an unrestricted license.
Thank you, Chairman Dr. Kumar. Do you have an amendment on the legislation? Please verify with me that it is
Sir.
drafting code 4942.
Yes, thank you, Mr.
So a
Chairman.
motion. We have a second. All those in favor of placing amendment drafting code 4942 on the bill, please signify by saying aye. Any opposed, please say no. The bill is amended. All right, Chairman Dr. Kumar, you've given us an explanation. Any further comments on the legislation as it's amended?
Yes, sir.
Okay. No further. Okay. Any questions or comments? Chairman Williams, you are recognized.
Thank you, Chairman, Dr. Representative Kumar. A quick question: why 3 out of 5 years? Is you thinking maybe somebody would have taken like maternity leave or?
Generally, the idea is that they are fairly current in their practice of medicine or their field. And you don't want somebody who practiced 2 or 3 years, 10 years ago, and something's happened and they've been out in the wilderness. So it should be that they are in active practice, and was one number that seemed reasonable.
Are you at all concerned about the number of patients or maybe the hours that they would see patients in that 3-year period, or is that not relevant?
Generally, it's not fully verifiable, but that's where the evaluation by the hospital that is willing to hire them, again, is a reputable institute with a residency program, as well as the Board of Medical Examiners will evaluate your qualifications.
Okay, thank you.
Thank you. Chairman Terry, you're recognized.
Thank you, and appreciate you bringing the bill. If you can kind of walk me through this on a foreign medical graduate. So would these folks have taken like the USMLE, or how would that work with this before they could get a license?
Their path to getting a license will be to have their qualifications and training verified, and then be accepted by an institute that has a residency program that is approved by ACGME, Accreditation Council for Graduate Medical Education, and then they are able to work there for 2 years to prove the point they are qualified to get a license.
So would they not have to pass the same USMLE license that we have here, or is it that we're saying that a foreign license is equivalent to us passing the USMLE as long as I'm not following how this process would work.
It does not require for them to pass USMLE as long as their qualifications are verified and they have the offer of employment from a reputable institution with residency program in the United States.
Okay, so it's obviously been a while since I've been through residency, so I don't recall this stuff. But so foreign medical graduates that actually do come and participate in a residency program, are they not required to do the USMLE, or I'm just trying to.
The alternative pathway for them used to be the ECFMG, Educational Council for Foreign Medical Graduates. And I think you're right, that has been transferred to USMLE. But this provides an alternative pathway.
So they would have passed the foreign medical graduate exam, and we're saying that's equivalent, and then they're going to have this on top of that? Is that how that would work?
No, I think ECFMG is no longer given. That council is not active anymore. It is that generally, so far at this time, you're right, that they will take USMLE, which is the exam to practice. But if they pass the USMLE, they have to have so much time of training within the United States for them to qualify for USMLE. They cannot just come into the United States without having a training program here and take USMLE. So they will, the alternative, this is again an You can come here on a residency with a residency program, train for a certain period of time, take the USMLE, and then go into practice. This alternative pathway is that if you have offer of employment and your qualifications are verified, then after working 2 years in that position, you will get an unrestricted license. Now, they will not get a specialty license. If they want to be a surgeon or an anesthesiologist, they still have to take those boards. They will not be able to achieve their specialty. This will give them a basic license to practice medicine in the United States.
So this would be basically, if they wouldn't be accepted into like an anesthesia, like I said, anesthesia, because they would have to have other licensure internship. This would basically be for people that were more primary care.
Sure.
Okay. All right. Thank you.
Thank you very much. Questions or comments for the sponsor? Because we're ready to vote. All those in favor of sending House Bill 1312 as amended to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman.
Thank you, Chairman Kumar. All right. We're going to go back onto our schedule. Item number 10 on our calendars, House Bill 1455 by Chairman Faison. The request has been to roll this bill 1 week. Without objection, House Bill 1455 rolled 1 week. We've already disposed of item number 11 on our calendar. House Bill 325 has already been disposed. We are going to item number 12 on our calendars. House Bill 634 by Chair Lady Moody. The request has been to roll House Bill 634 for 1 week. Without objection, House Bill 634 is rolled. Item number 13 on the calendar, Chairman Farmer had stuck his head in the door and he is, wow, ask and ye shall receive.
Okay.
Chairman Farmer, your bill is House Bill 1358. You have received a motion and a second. You are recognized, sir.
Yeah, thank you, Mr. Chair. Committee members, that's the most exercise I got in a few years there, running down the hallway. I sure need it. But this is a resolution I brought. A constituent of mine had asked that I asked the committee and us to pass a resolution about this metachromatic I can't even pronounce that, leukodystrophy, MLD. It's a
Are you
rare.
on, Chairman, before we go forward, are you on House Bill 1358?
I hope so.
Let me make sure.
I am, and it's probably because there's an amendment on there, Mr. Chair. You have 3751?
Sir, we do not.
Okay.
We have not received that amendment in the system
Okay.
as of this moment.
Okay, and I do apologize, and I just asked the committee just to give me a roll, maybe next week, last calendar, is that
Okay.
what we're doing? I'll be sure to get this thing in a proper form, and I apologize for any inconvenience I've caused you all.
No
Okay.
worries at all. I'm glad you got your
get-
exercise in.
Yeah.
Yeah, glad you got your exercise in.
Yeah, just try to be more like you, Mr. Chair, you know?
That's a low bar.
Yeah.
Without objection, House Bill 1358 is rolled 1 week. Thank you, Chairman Farmer.
Thank you so much.
Chairman Farmer, was that all you had before the committee? We can call you back, and if you need some more exercise. All right. Thank you very much.
Item number 11.
All right. Again, following the calendar, we're on item number 14, House Bill 942 by Representative Alexander. The request has been to roll this bill for 1 week. Without objection, House Bill 942 rolled 1 week. Okay. We are now on item number 15 on our calendars. Chair Lady Helton, you are recognized on House Bill 779 by Chair Lady Helton. You're recognized.
Thank you, Mr. Chairman.
We have a motion. We have a second. We have a plethora of amendments, potential amendments there, and I'm going to let you tell us which one you want to work from there, Chair Lady.
I'm going to adopt all three. So
Okay.
probably be easier to do that and then explain the bill.
I know which.
I have 4362, 4572, 5570.
All right, ladies and gentlemen, if you will notice on your calendars, on your amendment packs there, we actually do have 4 amendments. Chair Lady has suggested that we will only be adopting the 3 amendments that she has suggested. And in order to get the bill in proper posture, we will go ahead and work our way through those.
Okay.
Amendment number 1 is drafting code 4362. We have a motion. We have a second. All those in favor of placing this amendment on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. We have second amendment. House Amendment number 2 will be drafting code 4572. We have a motion. We have a second. All those in favor of placing this amendment on the legislation, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. We are amended. And the last amendment that we have is drafting code 5570. We have a motion. We have a second. All those in favor of placing this amendment on the legislation, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Did I call that correctly? Okay. All right, just a little paperwork up here to make sure we're all. Chair Lady Helton, as we work on this, if the bill moves forward, is this something that you would want to combine these amendments into one, or is we were discussing how the posture is with the Senate? Any preference?
I think it would be easier to roll them into one. If we can do that.
Okay. We get the high sign from legal staff.
Okay, thank you.
And that is certainly something that we can accomplish if that helps the
Okay.
ease of the legislation. All right, Chair Lady, you are recognized on your bill as amended.
Thank you, Mr. Chairman. Currently, there's no statutory time frame that requires a health licensure board to issue a license. This legislation will establish reasonable timeframes that licensure boards should either issue a license or notify the applicant that they must appear in person before the licensing board. The reason for the change is the issuance of licenses has been getting longer and longer, and healthcare professionals have been waiting longer to be able to go to work in Tennessee. And this is a common sense approach to ensuring that our workforce is able to work as quickly as possible and that state licensing boards are not impeding addressing the workforce shortage concerns. And the First Amendment, 4362, requires the Board of Medical Examiners, the Board of Osteopathic Examination, the Board of Nursing, and the Board of Physician's Assistants to, within 45 days of receiving a completed application for licensure from an applicant who is licensed in another jurisdiction, to render a decision on the application or inform the applicant of the need to appear before the board. The Amendment 4572 just adds "or" to render a decision on the application or inform the applicant of the need to appear before the board. And then the last amendment applies to the Board of Alcohol and Drug Abuse Counselors within 60 days of receiving a completed application for licensure from an applicant who is licensed in another jurisdiction.
Thank you for that explanation. Thank you. Questions or comments for the presenter? Chairman Leatherwood, you are recognized.
Just kind of following the amendments, the original bill had 45 days.
Yes.
And then one of the amendments was moving it to 60 days. Is that something people had agreed upon, changing it to the 60 days or the 40?
Yes, they agreed upon that.
But is the 60 days in there since we didn't put Amendment 3 on?
We did add that amendment.
Which, did we do Amendment 1, 2, and 4? Yeah, we did amendments 1, 2, and 4.
I think this is just a amendment number 4. Is it 5570? Is that what you have? It was just numbered on my paper as 3 because we're just doing the 3 amendments. It was just,
But did we change the 45 to 60? And perhaps this is a question for legal. Was the 45 changed to 60 in Amendment 1, 2, or 4 that we put on?
the 3rd amendment is actually going on Chairman Martin's bill. I can't remember who all is falling under that amendment. There's a whole list of others.
Chairman Leatherwood, that's a very good question, and I think we will need to go into recess to address the question. We're going to go out of session for a moment, try to get some answers on that question for you.
Thank
Out
you.
of session.
So is it supposed to be?
All right, we are back in session. And Chair Lady, we are working on some clarification, and I believe that you have some information. We do have some discrepancy within the legislation. Some dates are 45, some dates are 60 days. And as Chairman Leatherwood had adeptly noticed in the legislation and the mandatory language, can you please clarify where we are? You're recognized,
Yes.
Chair Lady.
Yes, sir. Yes, Mr. Chairman. I've been told that this caption opens Title 68, and that's why this is 60 days. Did I say that right? The 45 days meet every other month. Every other month.
The 60-day time frame meets quarterly, so they couldn't meet a 45-day time frame without having to call.
Which one meets quarterly? This one?
That's right, the last one meets quarterly, that's why it's 60.
Okay. May I speak? Okay.
Chairman,
Out of session, yes.
is it
Are we in
appropriate to
session?
go back into session and maybe roll them one space, let them sort it out, and then we could get to the other bills?
Thank you. The request has been to,
Okay, I've got the clarification. The 60 days, they meet every other
pardon,
month.
one moment, Chair Lady. Let me make sure we are back in session. I'm going to signify that we are back in session for debate, even though we may not have been out. But now we've belt and suspenders on the situation. Chair Lady Hilton Haynes, you are recognized.
Thank you. The difference in the days, the 60 days, the 60-day meets every other month. The board does. The 45 days meet quarterly.
Okay. Chairman Leatherwood, does that help? Chairman Leatherwood, you're recognized.
Yeah, that helps.
Okay.
Thank you. Thank you.
All right. Further questions and comments? I believe the committee has indicated they are ready for a vote on this legislation. Chair Lady Hilton Haynes, I believe we're in a good place, although we may not have got all the description we need on this particular legislation.
I'll make sure to have it in
Yeah,
full.
in conference with some of the attorneys and conference with members, I think there is a comfort level going forward as you work on this piece of legislation. But we'll just ensure that
Thank you.
going forward, we'll make sure all the T's are crossed and the I's are dotted going forward.
Thank you.
I think we're ready to vote. All those in favor of sending House Bill 779 forward to full health as amended, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you.
Thank you. And Chair Lady Hilton Haynes, you are recognized on item number 16, SJR 44, Senate Joint Resolution 44. You're recognized.
Thank you, Mr. Chairman.
You have a motion?
Cardiovascular disease is the leading cause of death in the United States, killing more people each year than all forms of cancer and accidents combined. SJR 44 urges state agencies to expand comprehensive cardiovascular screening programs to allow for earlier identification of patients at risk for cardiovascular events. It urges state agencies to explore ways to collaborate with federal and national agencies to establish or expand comprehensive cardiovascular screening programs. Urges an update of the state's cardiovascular plan to accelerate quality improvements in patient care, and supports the creation of policies to decrease the rising number of deaths of Americans as a result of atherosclerotic cardiovascular disease.
Thank you. Do we have a motion? And motion and a second. And thank you. I thought I heard one earlier, but just to confer what my ears told me. You have heard the explanation of Senate Joint Resolution 44. Ready to vote? All those in favor of sending Senate Joint Resolution 44 forward to full committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill,
Thank
your
you.
resolution
Thank
moves
you,
forward.
Mr. Chairman and Committee.
Chairman Martin, we have some other members in the audience who have been patiently waiting, and since you are sitting on this committee, I'm going to respectfully ask that we allow some other folks to jump ahead of you, if that's okay. Without objection, we're going to roll. Well. Okay. We're going to roll that to the heel of the calendar, and if we get to it soon enough, we may take it up out of order as well. So, without objection, item number 17, House Bill 496, is rolled to the heel. We are now on item number 18 on our calendar by Chairman Boyd, Senate Joint Resolution 62. We have a motion. We have a second. Chairman Boyd, you are recognized on Senate Joint Resolution 62. Thank
Thank you, Mr. Chairman of the committee. Senate Joint Resolution 62 would designate February the 22nd as Hypertrophic Cardiomyopathy Awareness Day in the state of Tennessee, Mr. Chairman.
Thank you, Chairman Boyd. Much like we asked one of the members of the committee to sing a song last night, are you able to spell those words that you just pronounced? And no, you don't have to do that. Thank you very much. Certainly a worthy cause. Any questions or comments on the resolution? Hearing none, are you ready to vote? All those in favor of sending Senate Joint Resolution 62 to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Resolution moves forward.
Mr. Chairman, I do have number 26, if it would be possible for me to get that while I'm here.
Chairman Boyd, item number 26 may take some time, and I feel that as we are a little bit late in the afternoon, we're going to remain on the calendar, sir.
Thank you, Mr.
very
Chairman.
much. Thank you very much. All right, ladies and gentlemen, we are on item number 19 on our calendars. House Bill 334 by Chairman Hurt. There is Chairman Hurt. You have a motion and a second. You're recognized, sir.
Thank you, Mr. Chairman and committee. House Bill 334 committee deals with sleep studies. So I hope that none of you fall asleep during my explanation here and can stay with me. Interesting situation we've got here that we're trying to address. House Bill 334 pertains to the shortage of licensed sleep study technicians. The lack of good night's sleep is an epidemic in Tennessee, but we do have a shortage of sleep technicians, only about 400 statewide. Once diagnosed with a sleep disorder, it can take up to 2 months in Tennessee to be treated. So how do you get to be a sleep technician? First, you need education and training. Then you must pass a test approved by the Tennessee, let me try this one, polymosonography Professional Standards Committee. And not even going to work on the spelling there, Mr. Chairman. And then you must be licensed by the committee. Current law allows students to take 3 kinds of training to qualify for the exam, but there's a catch. The most common sleep technologist training program in the country is the program accredited by the American Academy of Sleep Medicine called A-STEP. These programs require more than 80 hours in the classroom plus field experience. A-STEP training is approved in current law, but only if other, more expensive programs don't come into the state. If they do, then the A-STEP program goes away as an option. You wouldn't open a business if you had to close because your competition came to town. But that's exactly what existing law does in this situation. It's a barrier to entry that creates shortages and raises prices, which is exactly where we are now. House Bill 334 is a very simple bill. It does one thing and one thing only. It simply says A-STEP training is appropriate regardless of what happens in the rest of the marketplace. It doesn't change the exam a sleep technician has to pass to get licensed, and it doesn't change the role of the board in licensing sleep technicians. The polysomnography committee is aware of this bill and has spoken positively of it in recent meetings. With that, Mr. Chairman, we have a chance today to help more Tennesseans rest easy, and I would ask for your support. I'll answer any questions. Thank you, sir.
Thank you, Chairman Hurt. And I recall when the polysomnography legislation came into being 15, 16 years ago. So I have the institutional knowledge and recollection. I've slept since then, but
good one.
I'll be here all day. But thank you, and I think some updates are needed in this legislation. So I do appreciate you bringing this forward. Any questions or comments for the sponsor? Question is called. All those in favor of sending House Bill 334 to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. House Bill 334 moves forward to full health committee.
Thank you, Mr. Chairman and committee.
Thank you. All right. Item number 20 on our calendar, House Bill 573. The request has been to roll House Bill 573 for 1 week without objection. Item number 21 on your calendars, House Bill 647 by Chairman Baum. The request has been to roll House Bill 647 for 1 week. Rolled 1 week without objection. We're now on item number 22 on our calendars. House Bill 1077, House Bill 1077 by Representative Thompson. You are recognized, sir. We have a motion. We have a second. You recognize, sir. Make sure your mic's on, please, sir.
Thank you, Mr. Chairman. Now, as amended, House Bill 1077 fixes inconsistencies.
Representative Thompson, I believe you mentioned an amendment. Is that drafted
Oh,
code
yes, sorry.
55042?
That's correct.
Have a motion and a second. We'll go ahead and put the amendment on the bill as we work through it. All those in favor of placing Amendment 5042 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended for explanation. You're recognized.
Thank you. As amended, House Bill 1077 fixes inconsistencies in our code to allow our local vendors and farmers to prepare and sample at our local farmers markets. The bill defines a farmers market unit and creates a farmers market food unit permit, which would be issued by the Department of Health. It also sets up a permitting process for qualified applicants who must successfully complete a pre-operational inspection and pay a fee of $300 per operator. Once permitted, this will allow our local vendors to again have that parity in our law that will allow them to prepare and sample food at our local markets just as if they were at a special event. The second thing it does is allow for vendors at farmers markets to offer samples of food for consumption without having to obtain a license or a permit. Basic food safety protocols are outlined in the legislation and requires vendors to comply with all sanitary requirements. In closing, basically, this supports our local farmers and small business owners, but also aligns standards with our code to make this regulation more equitable and work better for our citizens. I'm happy to answer any questions.
Thank you, Representative Thompson. Chairman Jernigan, you're recognized.
Thank you. I'll be quick. I was going to carry this bill. I have a farmer's market in my district, and they would prepare in the morning cookies or a pie, and they bring it in. And then the local health department came and said, you need to individually package these every day before you can sell them. And that's just an administrative burden to these folks that they just baked a pie. Now, they still use the gloves, like you would anything else, but they bake a pie that morning. They put it out, and they serve an individual slice. They have to go in, package it up, put it out. It's an expense. It's a labor. It's something that's not needed. So I appreciate you bringing the bill, and I'll be supporting it today. Thank you.
Thank you.
Thank you. Any further questions or comments for the sponsor? Ready to vote? All those in favor of sending House Bill 1077, again, House Bill 1077, to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chair and Committee, and thanks for squeezing me in.
You're welcome. Item number 23 on our calendars, House Bill 709. The request has been to roll House Bill 709 for 1 week without objection. We are now running up against the clock, but Chairman Reagan would like to address us. Item number 24 on the calendar, House Bill 1380. Chairman Reagan, you're recognized.
Thank you, Mr. Chair, and we will run out of time before this bill is complete presentation. So I would ask the committee to, since I brought witnesses, to let them testify, and then I'll finish that on item number 1 of the next calendar if possible.
Without objection, the request has been to go out of session to hear. We have Rolf Hazelhurst and we have Bernadette Pager. Will both of you be speaking or one of you be speaking?
Let's see what we do in time. Go ahead.
With our time commitment, we will go out of session, and Rolf Hazelhurst will be recognized. If you could tell us who you are, who you're with, your interest in the legislation, and we will begin 3 minutes. You're recognized, sir.
Thank you. I'm Rolf Hazelhurst. I'm from Jackson, Tennessee. I'm the senior staff attorney for Children's Health Defense. I'm also the parent of a vaccine-injured child. The main point I'd like to make is that, unfortunately, because of legal activism and misrepresentation of the mature minor doctrine by the Tennessee Department of Health, unfortunately, Tennessee is leading the way in allowing children, in the legal battle to allow children 14 years and older to be vaccinated without parents' knowledge or consent. This policy is not only wrong, dangerous, but it also violates federal law, specifically the National Childhood Vaccine Injury Act. Legal issue is complex, but the bottom line is if the General Assembly does not act to clarify this issue, the practical effect is to be allow children 14 and above to receive vaccinations without their parents' knowledge or consent, and there's nothing parents can do about it. So I would ask you to vote yes in favor of House Bill 1380. Thank you very much.
Thank you very much, sir. Any questions or comments for the gentleman that spoke? Seeing none.
Mr. Chair, I've coordinated with the other witness. They can come back.
Okay. Thank you very much. We are back in session. Chairman Reagan, thank you very much. We are out of time. We've lost the room, and since we are out of time, all the remaining bills on the calendar will be moved to our next calendar without objection.
Thank you, Mr. Chair and committee.
Thank you. Ladies and gentlemen, without objection, we are adjourned.